Okay, good morning to everyone. We are very happy to welcome you here in Sevilla. So let's try to adapt the time because it's going to be a very, very busy day. Basic concepts in UBE. I'm Dr. González, I'm a neurosurgeon. I work here in Spain and I'm a very, very lucky woman because I live and work in Balearic Islands in the private system, and I started my adventure in Biportal in 2015 with my professor and friend, Dr. DJ Choi. The basic concepts in UBE that I want that you keep in mind, there were probably many of you that already know it, but it's important to review. The differences with Uniportal, we have underwater surgery, very important concept. The indications that we can treat today with Biportal, instruments and settings, main approaches in UBE, skin marking and portal position, and how to get the working space and the target. So, Biportal and Uniportal are endoscopic techniques, but Biportal is not only one portal more, as many surgeons say. So, in my opinion, Uniportal and Biportal should be complementary, and they have different concepts. This is, for me, the main thing to understand. Biportal is a floating technique. You can move easily inside the canal, and we have a separate portal. The working channel is in one side, and the viewing channel are separate. So we have a very flexible space for our instruments. It provides a clear and a wide surgical field of vision, and very important for beginners is that we can use, the instruments that we use are very similar to the conventional open spine surgery instruments. So it's very familiar to the surgeon. This is a fluid medium surgery. So it's an underwater surgery. It's very important to have some basic concepts of hydrodynamics in mind to have a successful procedure and a safe procedure. If we have some concepts clear, we will reduce our operative time, and we will provide to the patient a more safe operation. The underwater surgery has some advantages. We have a clear operative field. It gives us a very, very low infection rate and a very, very low fibrosis rate. But the underwater surgery in the spine has some specific considerations. We have some disadvantages. If we don't manage, the water, we will have a blur operative field, what we call the red screen. And the most important thing for me is that if we don't manage, the water, we can have a very, very severe neurological complications. So, how to manage the water dynamics? The optimal hydrostatic pressure is between 30 and 50 millimeter, and is calculated dividing the height of the, from the back of the patient to the back, in the between 1.36. It's very important to have a good input and a good output of the water. And for that, I recommend to do, if you use the horizontal portal, to open the fascia in a cross-shaped way and work with the dilator to have this good output of the water. When you go with the scope, if you don't have affluent water output, please go back and repeat the steps, because if not, the procedure will be longer and longer. Very important tool, you will see everything in the workshop, the use of semitubular retractor in the portal, in the working portal, keeps open the working portal and facilitates the water output. These are the indications today. Why I say today? Because the indications of Biportal are becoming wider and wider. When I started, the only procedures that we can do was lumbar. And today, there are some colleagues removing tumors and even doing decompression in chiari malformation. So for basic course and the beginners, it's very important to know that the lumbar procedures are the first step. Discectomy, lumbar spine, decompression, foraminotomy, and when you are here, you can go following the other lines. Each line has its own learning curve, so please respect this scheme. Anesthesia, I perform the procedures with general anesthesia because my anesthesiologist is more comfortable with that, but the procedure can be performed as well with sedation or epidural anesthesia. This is our room setting. It's only an example, but it's important that you have your own room setting to facilitate the rest of the team to know how to order all the setup of the OP. Three main things we need: water, C-arm, and an arthroscopy tower. If you have this, that is available in most of the hospitals all around the world, we can try to think in doing biportal. So we need to do biportal, specific instrument sets, a RF system, and a drill system. There are different models, different brands. You will be able to try in the workshop many brands and many models, and speak a lot about how to manage it. Three main approaches in biportal: posterior approach, contralateral approach for foraminal pathology, we will see and discuss a lot during these 3 days, and paraspinal approach for the extraforaminal area. Skin marking and portal position. We have two different ways. If we take the reference of the pedicles, this is the more extended. For the left approach, we will put the upper portal just below the upper pedicle, and the working portal just in the medium pedicle line. You can have the reference of the interlaminar space, and you can put the upper portal in the free margin of the upper lamina and the lower portal in the free margin of the down lamina. Each one has advantages, disadvantages. We can discuss during the workshop and during these days. And for finish, the last concept, make the working space. Here we don't have a knee, we don't have a shoulder, we don't have a hip. We don't have really a real space. So we need to create between the fibers of the multifidus. So take your time, because this is very, very important, okay? To reach the main target, and the target is the spinolaminar junction. So, main basic concepts. This is a fluid medium surgery. Please be very careful. You need to manage the hydrodynamics to have a safe surgery for the patient. Skin marking and portal position. And go back home knowing how to do this working space and reach the main target. But for me, the main message is: enjoy and learn a lot during these days. We have prepared everything, focus in your learning and your enjoying, and try the origami challenge. It's very difficult, you will see, but it's not impossible. And make very good friends, because you are the most important here, because with you, our community will become bigger and stronger. Thank you.